Dr. Roy Hall here with Mountain Health Functional Medicine in Billings, Montana. And I just want to make a quick announcement. I love it when controversy comes up in the news because that gives us a time to have some dialogue and a time to agree or disagree with what the news is. And one of the news pieces most recently is an article that appeared in JAMA, which is the Journal of the American Medical Association, talking about the detriments of using bioidentical hormone replacement in men. And what the study showed is the guys who got this had increased trouble with heart problems. And I have to tell you, this is one article out of very many that goes contrary to all the articles in the past. In the past, the articles either show no adverse effect or, what's more important, a beneficial effect of replacing hormone, particularly testosterone, in men. So this is the first article in many, many years to show a detriment. And one of the problems with this study is it's called an observational study that was retrospective in nature, and it's fraught with compounding biases that are very difficult to control with. It would have been better had this been a randomized study, which it was not. And again, this is the only one study that's showing detriment out of many articles showing benefit. And one of the interesting things would be if this article occurred, say, 5 years ago, 6 years ago, and we had all these other articles showing benefit, that one article would be discounted. But because it's the newest one out, people focus on that and say, hey, this is the newest thing because it's new, it's got to be true. No, it doesn't have to be true. And again, even the authors say, we need more information. This is not making sense to us. But I have some notes here. What the other articles show is several things. One is mortality in men who are treated with testosterone compared to control groups have a much better survival than men who are not treated with testosterone. All the other studies also demonstrate physiologic benefits of testosterone administration on things such as cholesterol, lipoproteins, insulin sensitivity, diabetes, inflammatory cytokines, endothelial dysfunction, atherosclerosis, blood pressure, memory loss, Alzheimer's, mood, strength, energy, muscle mass, fat, osteoporosis, erectile dysfunction, sexual function, and overall mortality goes up or improves when testosterone is given to men. And other studies show a much better quality of life for men who receive testosterone. So again, this is one study that recently came out in JAMA showing a detriment. Many, many other studies showing just the reverse. We do need more information. We need to keep looking at this thing. So what do we do now? Well, docs who are familiar with hormone replacement therapy, we all agree, let's continue to do as we're doing, and let's continue to do as we're doing, gathering more information. Would I stop giving hormones to men who are low in testosterone? Definitely not. Am I going to stop taking testosterone because mine is low if I don't replace it? Definitely not, because I know the articles show improved length of life, decreased heart attacks, decreased Alzheimer's, increased bone mass, so there's no osteoporosis, and I feel so much better. So I love controversy because, again, it gives us a chance to have some dialogue. So talk to you later. You make up your mind, get with your doc, and let's get you feeling better. Thank you. Bye.